Hey, what's going on, guys, and welcome back to another video of Keep It Simple Stupid, and also happy 4th of July. At least it is 4th of July while I'm recording this. Today's video should be pretty straightforward. It's something that I probably should have known sooner in my medical training, but it's something that I didn't have a really strong grasp on. So as usual, I decided to research the topic, and now I can explain it to you guys. And what that topic is specifically is what is a complicated versus an uncomplicated UTI, which is an abbreviation for a urinary tract infection. So let's go ahead and get into it. The first question we need to answer with this is, what is a UTI? What is urinary tract infection? So the definition of a urinary tract infection is that you have clinical symptoms plus a urinalysis, or a lot of times we call it a UA in the hospital, a urinalysis supporting infection. So you need these two components, 1 and 2, to diagnose a urinary tract infection. What are those clinical symptoms? So you can have dysuria, which just means it hurts when you pee, increased urinary frequency, urgency, suprapubic discomfort, and then hematuria, which is blood in your urine. All right, so we've discussed the clinical findings. What are the lab findings? So these findings will come up when you order a urinalysis. So one of them will be a positive leukocyte esterase. It could be nitrite positive. And then pyuria. And the definition that I found for this is that it's greater than 5 white blood cells per high-powered field. And then, of course, bacteria on microscopy, and then if the urine pH is greater than 8, because that could indicate you have a urease-splitting bacteria in your urine, like Proteus. So the next step here, we've discussed what a urinary tract infection is, what are the clinical and laboratory findings you need to find to diagnosis. Now let's go ahead and discuss uncomplicated versus complicated. So an uncomplicated urinary tract infection, it's in healthy, non-pregnant, premenopausal women with no structural or functional abnormalities of the urinary tract. Now, obviously, there's a much larger list here, and this is for a complicated urinary tract infection. And what makes it complicated, and I've written this out here, is that there are now risk factors that increase infection risk or a risk of failing therapy, so antibiotics. So what are these risk factors? Well, it's basically going to be everything that didn't apply to the uncomplicated patient. So a male patient, UTI obstruction, so specifically that's going to be stones, strictures, things like that. Indwelling catheter, neurogenic bladder. So think of someone who maybe had spinal trauma, they have a neurogenic bladder, they have a tough time urinating. And from the neurogenic bladder patients I've seen, a lot of the times they have an indwelling catheter. But neurogenic bladder, also a recent neurologic procedure, also a renal transplant, and then also a pregnant patient, so that will complicate a UTI, diabetes, immunosuppression, and then anatomic abnormalities. Now, very quickly, we're just going to discuss some of the treatment options for uncomplicated and a complicated urinary tract infection. Now, for the sake of this video, this is assuming this is a hemodynamically stable patient who's afebrile who is going to be discharged. All right, so here are some of the options. You can do nitrofurantoin, 100 milligrams PO BID for 5 days, TMP SMX, aka Bactrim, 160-800 milligrams PO twice a day for 3 days, or fosfomycin 3 grams PO once for 1 dose. Personally, I've ordered nitrofurantoin before. Maybe a couple times Bactrim, but generally from the patients I've ordered antibiotics for an uncomplicated UTI, more commonly it's going to be Keflex. Now for our complicated urinary tract infection. Okay, and little caveat here, so this is going to be outpatient treatment, right? So we're assuming that this is, again, a stable patient, afebrile, they're not tachycardic, they're not hypotensive. So what are the treatment options for these patients? So you're going to need a little heavier gun antibiotics, so you can use ciprofloxacin, 500 milligrams PO BID for 7 days, levofloxacin, 750 milligrams PO daily, 5 to 7 days. Bactrim comes back into the picture, 7 to 10 days, and then Augmentin, 7 to 10 days. And of course, the Cipro and levofloxacin, those are both in the fluoroquinolone class. All right, well, that's all I have for you guys today. I didn't want to discuss asymptomatic bacteriuria. I think that could be a topic for another video, maybe my next one. I hope that now you have a basic understanding of what differentiates a complicated versus an uncomplicated urinary tract infection. Again, happy 4th of July. If there are any specific topics you would like me to cover, please let me know. Like, comment, subscribe, and I'll see you guys next time. Thanks.